Here we go, brand new edition of Sports Medicine Weekly on this Saturday morning. Hi, everybody. Steve Cashel, along with my usual co-host, Dr. Brian Cole. He is the head team physician for the Chicago Bulls, one of the team physicians with the Chicago White Sox, sports medicine specialist, orthopedic surgeon at Midwest Orthopedics at Rush. Our website is sportsmedicineweekly.com. Another week, Doc Cole, during the holidays. How you doing?
I'm doing great, Steve. It's great to see you.
Well, NFL injuries continue to take over the headlines. Got an interesting little case for you, okay? Let me go through this. Redskins running back Darius Geis, as we get into it, all right, tore his left ACL against the Patriots, forcing him to miss the entire 2018 season. Now, in week 1 of the 19 season, this past season here, he's torn the meniscus in his right knee. Now, then he suffered an MCL strain in the same knee as the prior ACL reconstruction. And he said, and I quote, "It was definitely planted really firm. I thought I broke my leg and my ankle. You can't tell from that angle, but my knee went in pretty good before my feet came off the ground." End quote. What comes to mind?
Well, I think there's a lot of confusion between, and now he's got a knee with an ACL and an MCL. And interestingly, not uncommonly, when someone has an ACL tear, they often have an associated MCL tear. So specifically, ACL is the anterior cruciate ligament, and MCL is the medial collateral ligament. That's on the inner side of the knee. And the fundamental difference is most MCL injuries never need surgery. So that's a good thing. These love to heal, as we say. The biologic environment is excellent. Patients or players or athletes after they have this injury, we often put them in a brace. We may limit their weight bearing for a bit. And depending on the grade, we grade them basically on a scale of 1 to 3, 3 being the worst. That dictates how much time it takes to get them back to play in a safe fashion. So this is one of the most common knee injuries in the NFL, by the way. It usually happens when the leg is planted. Someone comes at them from the side, much like this happened here, and it goes on a very acute or sudden angle and just pulls on the ligament on the inner side of the knee. The importance of that ligament is actually stabilizes the knee so the leg doesn't sort of wobble from inside to outside. It's a different type of ligament than the anterior cruciate ligament. It's one along the side of the knee rather than the center, and it just loves to heal, but you got to protect it after it get injured.
Haven't we talked about this before, where you do a left ACL and all of a sudden something happens in the right knee?
Yeah, there's unfortunately there is a sequence that we not uncommonly see when someone has an injured lower extremity, that they actually in some series have a higher propensity to injure the other knee rather than re-injure the knee that was initially hurt. So, and that's probably due to some neuromuscular or biomechanical, differences, given side-to-side differences in muscle strength and so forth. So, we have to be very conscientious in rehabbing both sides of the lower extremity, for example, even though one side is injured, because of the risk of injuring the side that never was injured to begin with.
Well, you've also told me in the past that you do an ACL reconstruction, and that is pretty strong, right? It can also be stronger than the other ACL.
Yeah, that's exactly right. Yeah, to my point, what we see statistically is if you do an ACL reconstruction, the re-tear rates are generally less than 5 to 7%.
Wow.
But they're actually higher than that in the other knee that never had a repair. And there's a lot of explanations for this, but it just speaks to the fact that how important proper rehabilitation is. We can do our jobs as surgeons and fix something, but if the rehab is not sufficient, there's a risk of re-injury.
Let's move on.